The anterior aspect of the chest or the thorax is known as the pectoral region. The pectoral region consists of the muscles that connect the upper limb with the anterolateral chest wall and also the mammary glands which secrete milk in females. We shall discuss in detail about the pectoral region. The major topic of our discussion are the cutaneous innervation of the pectoral region, the muscles of the pectoral region, the clavipectoral fascia, the mammary glands, the lymphatic drainage of mammary glands, along with breast cancer. The pectoral region is external to the anterior thoracic wall and anchors the upper limb to the trunk. Now, when we do the dissection, we can see that the superficial compartment consists of the skin, the superficial fascia, and the breast or the mammary gland, while beneath the deep fascia, the deep compartment consists of the muscles and the associated structures. Now, coming to the cutaneous innervation, in order to understand the cutaneous innervation of the pectoral region, we'll have to imagine a horizontal line drawn at the level of the sternal angle, which is also known as ventral axial line. So the skin above the ventral axial line or the horizontal line drawn above the sternal angle is supplied by the suprascapular nerve, which is having root value of C3 and C4. The skin below this ventral axial line is supplied by the anterior as well as the lateral cutaneous branches of the 2nd to the 6th intercostal nerves. Now coming to the pectoral muscles. There are 4 pectoral muscles and they are connecting the shoulder girdle to the thoracic wall and helps in the movement of the shoulder girdle. The pectoral muscles are pectoralis major, the pectoralis minor, subclavius, as well as the serratus anterior. So in this diagram, we can see the pectoralis major, the pectoralis minor beneath it, and serratus anterior on the lateral side. Now coming to the first pectoral muscle, which is the pectoralis major. The pectoralis major originates by 2 heads. One is the clavicular head and the sternocostal head. So clavicular head, as it is very clear from the name, it is having a connection with the clavicle. So it is originating from the medial half of the front of the clavicle. The second head or the sternocostal head is having connection with the sternum as well as the ribs. So it is coming or it is originating from the sternum, the upper 6 costal cartilages, and the lower part of it is taking origin from the aponeurosis of external oblique muscle, which is associated with the anterior abdominal wall. After taking origin from the 2 heads, it is getting inserted into the lateral lip of the bicipital groove, which is on the humerus, and it is supplied by the medial and the lateral pectoral nerves, which are having root value C6, C7, C8, and T1. The action of the muscle, as clear from its pull from the insertion point, is adduction and medial rotation of the arm. So the primary action of pectoralis major muscle is the adduction, that is, the arms will come close to the body or the trunk, adduction and medial rotation of the arm. Now the clavicular head is also involved in flexion of the arm at the shoulders. Now coming to the next one, which is the pectoralis minor muscle, which is a small triangular muscle that lies deep to the pectoralis major muscle. So during dissection, when we remove the pectoralis major muscle, beneath it we find a triangular shaped pectoralis minor muscle, which is a smaller muscle. As is clear from this picture, it takes origin from the 3rd, 4th, and the 5th rib near the costal cartilage, and it is inserted to the upper surface of the coracoid process of the scapula by a short and thick tendon. It is also supplied with the medial and lateral pectoral nerves. The main action is the punching action or protraction of the scapula. It also helps in depressing the shoulder point. And during forced inspiration, the pectoralis minor will act as an accessory muscle of respiration. The next one is a subclavius muscle, which is a small muscle found beneath the clavicle. As is clear from the diagram, it takes origin from the junction of the first rib intercostal cartilage, and it is inserted to the lower surface or the inferior surface of the clavicle in the middle 1/3 of the inferior surface of the clavicle. It is supplied by the nerve to the subclavius, which is from the upper trunk of the brachial plexus, and it steadies the clavicle during the movement of the shoulder. Now coming to the serratus anterior muscle, the serratus anterior muscle, strictly speaking, is not a part of the pectoral region because it is found on the lateral wall of the thoracic wall. Now the serratus anterior muscle takes origin by 8 digitation from the upper 8 ribs. The first digitation arises from both the first as well as the second rib. Now second digitation from the second rib, third digitation from the third rib, and so on until the 8th rib. It is inserted into the scapula, as is very clear in this diagram. On the left side of the scapula, we can observe that the insertion is into the medial border of the costal surface of the scapula. Now, nerve supply is by the long thoracic nerve or the nerve to the serratus anterior, which is having root value C5, C6, and C7. The serratus anterior muscle is also known as the boxer's muscle because of its very important action in powerful protraction of the scapula, that is in the punching and the pushing motion. Now, the overhead abduction or the above 90-degree abduction of arm is done by the lower 4 or 5 digitations of the serratus anterior along with the lower part of the trapezius muscle. We have seen that the serratus anterior muscle is supplied by the long thoracic nerve or the nerve to serratus anterior. Now, due to various reasons like carrying heavy load on the shoulder, by sudden pressure on the shoulder from above, because of a stab injury, or even during removal of breast tumors, there can be injury to this nerve. An injury to this nerve will cause loss of function of the serratus anterior muscle, causing loss of pushing as well as punching action, and also loss of overhead abduction action. This is leading to a deformity called winging of scapula. To test the winging of scapula, the patient is asked to press hands against a wall. So the side where the winging of scapula is present, in that side, the vertebral border and the inferior angle of the scapula would protrude posteriorly, as is seen in this picture. Now, the next important topic to be covered in the pectoral region is the clavipectoral fascia. The clavipectoral fascia is a strong facial sheath. In the anteroposterior plane, it is found beneath the clavicular head of the pectoralis major. The pectoralis major, as we know, has got two heads of origin. There is a clavicular head and also a sternocostal head. So the clavipectoral fascia is found beneath the clavicular head of the pectoralis major muscle in the anteroposterior plane. Now, if we are thinking in the craniocaudal direction, the clavipectoral fascia is found between the clavicle and the pectoralis minor muscle. Now, this fascia is having superior, inferior, medial as well as lateral relations. Superiorly, it goes above and joins with the clavicle. Now, we know that below the clavicle, there is a subclavius muscle. So, in order to enclose the subclavius muscle, the clavipectoral fascia would divide into two. It would enclose the clavipectoral fascia, it would enclose the subclavius muscle, and during this process, there is an anterior as well as posterior lamina formed. The anterior lamina would get attached to the clavicle itself, while the posterior lamina would become continuous with the investing layer of the cervical fascia, which would later fuse with the axillary sheath. Now, extending below, the clavipectoral fascia would again split in order to enclose the pectoralis minor muscle. After enclosing the pectoralis minor muscle, it would again fuse and become one and continue downward as the suspensory ligament of axilla. The suspensory ligament of axilla would become attached to the dome of the axillary fascia, and it would keep the dome of the axillary fascia pulled up and maintain the concavity of the axilla. Now, coming to the medial extension, medially the clavipectoral fascia would get attached to the first rib and also the costoclavicular ligament in the supromedial region. Laterally moving, it would get attached to the coracoid process of the scapula and would blend with the coracoclavicular ligament postero-superiorly. So the most important point to note is that the clavipectoral fascia would enclose two muscles, that is the subclavius superiorly and the pectoralis minor inferiorly. The clavipectoral fascia is pierced by four structures: a nerve, an artery, a vein, as well as the lymphatics from the breast. From about onward, the order is thoracoacromial artery, cephalic vein, lateral pectoral nerve, and the lymphatics from the breast. These structures follow an order of out, in, out, in. That is, the thoracoacromial artery is piercing clavipectoral fascia and moving out, while the cephalic vein is piercing and moving in, followed by the lateral pectoral nerve, which is piercing the clavipectoral fascia to move out, while the lymphatics from the breast is moving in. The first structure piercing the clavipectoral fascia, which is a thoracoacromial artery, it is a short branch from the second part of the axillary artery, which is located in the upper arm. It then divides into four branches, the pectoral, acromial, clavicular, and deltoid branches, and they supply the various muscles and tissues in the shoulder and the chest region. So it is a branch of the axillary artery that pierces the clavipectoral fascia and moves out, supplying the muscles of the shoulder as well as the chest region. The second structure piercing the clavipectoral fascia is the cephalic vein, which is a superficial vein in the arm. It is of great anatomical importance and significance because it is used in various medical procedures. So it is eventually piercing the clavipectoral fascia to empty into the axillary vein in the deltopectoral groove. The third structure piercing clavipectoral fascia, the lateral pectoral nerve. It is a nerve that originates from the lateral cord of the brachial plexus, and it is piercing clavipectoral fascia to move out and innervate the pectoralis major muscle and also pectoralis minor muscle. Now the fourth structure piercing are the lymphatics. These are the lymphatics from the breast. They drain to the apical group of axillary lymph nodes. Thus, we have covered the important anatomical details of the pectoral region. Hope it was helpful.